Guys, Dr. Pete Stover here. I want to tell you guys about a guided implant system, got a drill system I've developed with my friend Dr. Steve Williams from the Dallas Implant Institute. It's called Pilot Plus Dental. This is a picture from the website. It is a universally guided system. It's really neat. It comes with all of 3 drills. It can be used as standalone or in conjunction with your current system. Once you get your hole established, your osteotomy, you can flare it and adjust it. As you can see, there are 3 sizes there: 6, 8.5, 11.5. And so the idea here is, again, if you're placing a very large implant, you'll need to modify the osteotomy. But we're going to show you a case where they can be used as standalone and I'd say almost fully guided. And I'll show you what I mean here in a minute. So we got a case coming up here where we wanted to maximize our AP spread. And if you look at that distal implant, obviously we want to fit the biggest implant we can without having to risk sinus damage, without having to stick that implant in a prosthetically poor position. You know, we want everything to line up and be able to fit this tight. So I don't know about you guys, but freehanding and getting it that close is just not something I'm super comfortable with. But I do things like this guided pretty consistently. I've been using different guided systems, but we developed this one, really simplified it. So let's dive into the case. Let's take a look at this. So we're not gonna show you the entire thing, but just kind of hit the highlights here. So here's our guide in place, and this patient, you'll see in a minute, has a nice wide ridge, tons of keratinized tissue. So we're just doing a tissue punch. We're gonna go flapless here. I know Dr. Williams is a big fan of that. I tend to be more of a flapper, but when these cases walk in your door that just don't demand it, obviously we're not going to do that. So, but one thing I do want to point out is if you're going to use the surgical guide, it's not only great to help get the implant in the bone where you want it, but you've got a lot of information here. If you were laying a flap, for example, you could go in there and you mark the lingual aspect of where your implants are going to go, flap that, reposition it, and either roll that tissue, do a buccal roll or a lunar incision, if you would. And let's maximize the amount of keratinized tissue on the buccal. So you can use your guide to help you design your incision. So in a case like this, where we're going flapless, we might as well use that to guide our tissue punch. And so all we're doing here is cleaning that out. And you'll notice I'm going to go back in. Our distal implant's quite a bit bigger in diameter than the front one, and my next size up on my tissue punches is a little bigger than I really wanted to go with there. So we're just nibbling away a little bit of that surrounding soft tissue just to make sure when we're seating our implant, we're not going to get any soft tissue impingement or have anything, getting our osteotomy that we don't want down there. So again, so we're just cleaning that up. And so we're going to go back in with our guide here pretty quickly. Yep. And so we're going to start drilling out our osteotomy. We're just going to show you the front one. Back one works the same way. So depending on the length of your implants and the variables there, obviously we just repeat the second, but I don't want to make y'all sit there and watch all that. So on a distal implant extension like this, really important, we extend that guide all the way over to the contralateral side so that my assistant has something to anchor down to and make sure that this thing doesn't move. Because as you can guess, with that distal extension like that, it's going to be easy for that thing to move around. So we're being very diligent about making sure that's very secure. I've had this do over. I might even stick a pin back there, which really locks the back end of that in. And as you can see, as I'm drilling this, my inclination is trying to get to the buccal, but the guide won't let me. So it's going to kind of pull me back in. We're getting it started, but you'll see here in just a second, it's going to line me back up. Everything's going to drop into place. And, it's going to keep me from getting somewhere I wasn't supposed to be. And you'll see here in a second, yeah, it just kind of drops down. Now, I wanted to show you this just because. So even though these drills are designed to be used with a guide, and that's where they shine, they can be used freehand because they're depth limiting. There's a taper to those. The 6mm drill has 1 degree of taper, and then the guided portion will stop or act like a depth control. The 2 longer drills have a taper to them, so they gradually increase. So they're doing the work of 2 drills in 1, but they still have a depth limiting property to them. So all of us doing there is just showing that I can take that, put it in the osteotomy. It's going to it won't let me go any deeper than the stop will allow. So that's a known distance. So it's always nice to know that even if you want to place freehand, you can use these drills to control your depth. So if you look, this is an IX2, very aggressive thread, very pointy tip. Now, one of the things that, like I said, we're practically fully guided, but if you have a driver that fits the hole and drives the implant, technically that's called fully guided. But we're going to use all the data we have from our guide to control our depth here. So you couldn't see it very good. Here in a second, when we back this out, kind of hold the driver up, you'll see. So what I know is my offset on these guides is 9 millimeters. So I took my driver, placed an analog on it, measured 9 millimeters up the shaft or shank of the burr, made a mark, and then just took a little burr and notched that out so I could see that. So that's going to allow me to know when I've seated the implant to the depth of where the guide, the program has put us. So we'll know where we're supposed to be. So we're starting to, you'll see in a minute, we start getting a little torque. So I back off and grab the little torque lever and let's see where we're at. And so I know we're getting within a couple millimeters. So I'm going to take this off and I'm going to try to show you on the camera here in a second. So we know we're getting some decent torque there. We're about 40, 45, which is nice for a narrow-ish diameter implant. So we're going to take it off, take a look. I'm going to try to show you this notch on my burr. See that? If you look closely, you'll see a line just grooved into the shaft of the burr, or driver, pardon me. And so we're just taking a quick look, and it's where I thought we should be about 1.5 millimeters, 2 millimeters from seated. So we're going to pop the guide back on. We might as well use it. We could freehand it right there. Nothing wrong with that. You can just drill the hole and go freehand. But like in that distal site where the margin of error before we hit that sinus is millimeter or less, then I want every bit of information I can get to get me placed where we're supposed to go. So all we do is finish it off. We take it till the top of the line is even with the top of the guide tube or the guide hole. There's no sleeves or tubes with this system. And so we got her down where we want. I'm going to give it just a little turn to make sure my timing's good. I always like to put one of my hexes towards the facial. So when I'm restoring it, I know that we've got a prosthetic positioning for, I use CAD cam. So I like to know when those tie bases seat, that one of my notches will be on the facial. So there we are, everything's seated. Take a probe, feel around real quick, make sure there's no tissue caught under there, nothing that feels or looks out of the norm. And as you can see here, like I said, our margin of error was very small, and I'd say doing that freehand would have definitely stressed me out a little bit. But doing it guided, everything's perfect. Dropped everything right where it's supposed to go. Got that implant as far back as we can without hitting the sinus or endangering anything. So again, with a very simple 3-drill protocol, IX2 implants, we got this thing done quickly, efficiently, and very accurately. So when it's time to restore this, that'll be ready to go. So if you have any more questions or want to know more about this system, Premier 3D Lab is our website where we can help make your guides, buy the drills. We also have Pilot Plus Dental. It's another website where we put information on, just update cases and things like that. So we'll try to keep content coming just as we get more and more things to show you. So I appreciate you watching. God bless you. Hope you have a good evening, and stay tuned.